Good afternoon, everybody. Welcome to our presentation today from Mountain Pacific on the Nursing Home Quality Improvement Kickoff event that we have been waiting to anxiously provide all of you for a few months now. So we're excited to talk to you about the work that we're going to do together and how the contract has changed since the end of our last contract, which was already a year ago. So this presentation today will hopefully clear up any questions that you might have about the work that we're going to do going forward. I'm Mary Erickson. I'm the program director for the task order that we are working in right now. So I'll be your presenter today. And then I have the rest of our Mountain Pacific team that I'll be introducing and going over with you here as well. So we have everyone on board, so please feel free to engage and ask questions and all of that throughout the presentation. Just a couple of logistics. Please make sure your microphones remain muted during the presentation. It will be recorded and sent out to all registered participants along with any handouts that we also discuss. Please enter your questions in the Q&A or the chat box, and we will get to those as we go through. And then also we'll have a period where you can unmute and also ask questions and share your experiences with the group. We really love to hear from our audiences and hope that this is an engaging presentation. So the first thing that we want to talk about right off the bat is really just the overall difference between the last scope of work and our last contracts and this one. This contract is quite a bit different with CMS than in our past. So you'll see throughout the presentation and in our work how that has kind of also changed Mountain Pacific to some extent. The past scopes of work were very task oriented and specifically task focused. Most of the emphasis was on working individually with nursing homes, hospitals, clinics, providers, and beneficiaries. Now we are moving more towards coalition type work. And definitely a regional approach, which we'll talk more about in a minute. We are cross-task and cross-setting focused, so you'll see a lot of our goals include nursing homes in with hospitals and other community settings as well. So we are not quite as single task focused and single setting focused as we might have been a little bit in the past. The emphasis is really on working with coalitions and through collaborations to achieve goals. So you'll hear us and see us really encouraging nursing homes to be part of our coalition work if you're not already doing so. And then there is also an additional emphasis on engaging beneficiaries in their care, but also in the design of our improvements. So we'll talk some more about that as well. The regional approach, the most significant issue or change with the regional approach was that our outcome metrics that we will be evaluated by CMS will be rolled up into regional outcomes. And so our region did not change. It continues to be Alaska, Montana, Wyoming, Hawaii, and the US Pacific territories. So we did retain all of our states, which is very good. We were very pleased with that. And then in addition to that, this regional change has changed a little bit about how we work at Mountain Pacific. We are trying to have account managers be just a single touch point for all of our accounts in the states. And so, and then we are also coordinating a lot of our activities to be more regionally focused instead of just single state focused. So you will start to see some of that in the activities that we do. Just like today, we have nursing homes from all of our states on this call today. And you'll just start to see more and more of that. And I think that's really good. It allows us a nice opportunity to learn across states from each other and broaden that network even a little bit more. Hopefully for the benefit of the residents in our homes. Our team has changed a little bit. We will give you a handout also with this information on it. But for the nursing home points of contact in each of our state, we have in Hawaii and the territories, we have Mark Marabella and Maggie Oki, who have been working with us there for several years now and do a great job supporting the islands. We have Jill Holt, who has recently joined us in Wyoming to support the Wyoming nursing homes, and Marcy Gallagher, who is the support person for Montana, and Lisa Johnson, who is a support person for Alaska. And those two individuals have also been with Mount Pacific for quite some time and are doing a really great job at supporting the nursing home work and coordinating that. So you can see on our team, and I'm not going to talk about all of these team members, but we have several other team members that are helping us in a lot of other key areas. And you may from time to time hear from them, see them in presentations, in addition to lots of other things, see tools and resources that are developed with them. So we're pulling in our regional team members across states, kind of a bit of eliminating our state lines a little bit. So you'll get some exposure to a lot of the team members at Mountain Pacific. And of course, there's always the team behind the team. You know, we always have communications, IT support, data support, all of those staff too that we can access on your behalf through our account managers. Probably the next, a little bit more significant change for us was how the funding is being distributed to us. So essentially there are a couple of what I would call buckets of funding. The first bucket is specifically for coalition work, where a bulk of the funding will happen through, and then the other branch of the bulk funding will come through the nursing homes. This funding is fixed price, and it's also performance-based funding that essentially means that we will receive X amount of dollars as long as we perform Y, and as long as we have outcomes and achieve our evaluation metrics. So just like healthcare is transitioning to value-based purchasing, we are also transitioning to a performance-based contract. Our funding is really focused heavily now on helping communities solve healthcare problems together. And like I said earlier, it's not a requirement for nursing homes to be part of a coalition, but it is highly encouraged, especially when we begin talking about work around care transition. So if you are not already involved in that, we may offer you that opportunity in the future. So we're going to talk for a minute about the goals of this particular scope of work. So from a broad perspective, we essentially have 5 goals from CMS. The first one to improve behavioral health outcomes, which would include opioid misuse. The second is to increase patient and resident safety. The third to improve chronic disease self-management. The fourth is to improve the quality of care transitions. And the fifth is to improve nursing home quality. So a little bit deeper dive of that. We will be giving you this handout that gives you the specific goals and metrics that are associated with those goals. So we'll talk a little bit more later about data collection and how that is going with this scope of work as well around these areas. But you kind of see that we've outlined here for you the specific goals that include the nursing home setting. So goal 3 is specifically around chronic disease self-management. So primarily works with beneficiaries in their communities and is not necessarily directly related to nursing home care. So I won't go over all of these metrics. We'll do a lot more of presentations and work with you on deep dives into what these mean, but this gives you a sense of where we're headed and what we've been asked to focus on for the next few years. So some of our planned activities around those goals, the data collection. So we're providing the quality measure reports again. We've had a gap. We had quite a gap in being able to provide those reports because we did not have access to that data through CMS. And I just want to say thank you to everyone who stuck with us. And I know we tried to give as many updates as we could. A lot of times there was just nothing to update you on. But now We seem to be kind of rolling again, and we are reevaluating those reports as well to make sure that you're getting useful information. And then, of course, we can also, in the way of data collection, assist with developing facility process level metrics, and then the reporting that you're now required or have been doing with NHSN. We've been trying to support those activities with you as well. So under environmental scan, really what we're doing there is more at a higher level. We try to stay in tune with what's going on at the states, with our healthcare associations, with the survey agencies and the quality assurance divisions at the state level, so that we can coordinate our local work and hopefully not duplicate things for all of you. We will routinely be assessing the needs of nursing homes, residents, families, and just local care delivery systems as part of an ongoing reevaluation of the work that needs to be done. Collaborating and aligning work with like partners so we avoid that duplication, as I discussed, and work with our partners together to develop and implement different tools and resources. We are planning some activity around engaging and activating residents and families in their care and helping to integrate the resident voice into care delivery processes. So you have resident councils, so this is not necessarily something new to you, but if there are areas where we can help enhance that for you, we'd sure like to do that. And then implement improvement interventions, so spreading best practices, providing peer-to-peer network opportunities, providing you with access to subject matter experts, and of course, just that ongoing evaluation to ensure that your needs are being met. So that's kind of the rundown, the elevator pitch, if you will, of what we're going to be working on a little bit more specifically over the next few years as well. So,
Mary, we might have missed some of your advancing of your slides.
oh, did you not see the handout that I just shared? Did you not see the handout?
Yeah, never mind. I'm mistaken. No, we saw it.
Okay.
Sorry, Mary.
That's okay. Thanks, Crystal. So our vision for resident and family engagement is really to help support your resident-centric approach to community and nursing home work. So, you know, what also can the community start doing for the nursing homes, in addition to nursing homes being involved in, you know, community coalitions. So trying to get all of that flow going, assisting with technology trends and systems that impact residents and families, which of course is huge right now with telehealth visits due to COVID. So we're definitely prepared to also help you with that. Spreading awareness of cultural considerations, individual dynamics, and health literacy, and helping residents and families better understand their disease and actively participate in their plan of care. So when we talk about resident and family engagement, these are kind of the high level things that we are looking to get more involved in and support you more with. So our improvement support structure has changed, like I said, just a little bit. For nursing homes, we still have nursing home direct technical assistance to some extent, and that's taking a couple of different forms as well. So I'll talk about that too. But really everything is revolving around our affected beneficiary communities, the local coalitions, the state coalitions that we have, and then the regional affinity groups are all working to improve the health outcomes of our affected beneficiary communities. And what is that, might you ask? Affected beneficiary communities are the Medicare beneficiaries who reside in the communities in which we are working to affect healthcare. So all of those people that are affected by the care that you deliver are essentially what we refer to as affected beneficiary communities. These communities are defined, were defined during an analytics process and data analysis that we needed to do during the development of the scope of work with criteria from CMS. So there is a focus on rural and medically underserved population that have at least a 62% Medicare beneficiary proportion. The other term that might be a little bit new to you that I just talked about was an affinity group. And due to our regional model, we are finding that a lot of states have like problems. And so what we are trying to do is then instead of having, several different groups working on the same thing in different states, we're going to try an affinity group model where we work on those specific problems, purposes, goals together as a region. So those affinity groups, you might see us use that language and ask you to participate in those if you're working on something common that we've identified throughout all of our states. We envision these to be potentially short-lived. They might go, some of them might go for a year depending on the topic, but we intend for these to be intense, very specific groups that are not necessarily going to go on forever. They're going to set a goal, achieve the goal, determine what the next step is. Maybe it's still continuing to get together, but maybe it isn't. Maybe you've achieved your goals and we can disband that affinity group. So that is going to be a term that you will hear us use more often, probably in this scope of work and a strategy for improvement. Some of the other ways that we will be providing direct technical assistance, specifically, especially now within times of COVID and CMS is trying to provide support out to nursing homes in these times, will start to involve quality improvement initiatives. So I just wanted to talk for a minute about our different ways that we support nursing homes. So first of all, there's a general contract participation, which, if you signed a participation agreement already, then you're good to go. You're being included on things and we're just fine. The other methods of direct technical assistance that we do provide are, first of all, the beneficiary and family-centered care, so the BFCC referral quality improvements, which is a process where the BFCC sends us a quality of care concern and we provide targeted technical assistance to that entity that's referred to us. We currently do not have any active BFCC referrals in our region. The next method of targeted assistance are the targeted response quality improvement initiatives. This is kind of a branch off of the BFCCs, but these are provided, these referrals come directly from CMS, and the funding from CMS through these comes to us through these referrals. So it's different than the general contract participation. The QII referrals are based on past survey results and NHSN reporting, and we currently have 26 underway across our region. We have been asked under the targeted response QIIs to collect data and support processes in 4 key areas of hand hygiene, PPE, immunizations, and infection types and rates, specifically in nursing homes. If you've been referred to us for a quality improvement initiative, we will notify your home administrator directly. So this is not necessarily something that you have to request or anything like that. If you're going to be included in this initiative, then we will be notified by CMS, and then we will reach out to you. The last type of targeted assistance support that is new to us and new to CMS, and as a result of the COVID pandemic, is a new initiative that's been directed by Health and Human Services to activate the QIO program and provide intensive assistance to impacted homes in COVID hotspot designated areas. I am very relieved to say as of right now, we do not have any hotspot referrals. And so we're hoping that our communities are staying healthy and that this will not be an area of concern. Should this come up, we will notify your home administrator directly if we receive this type of referral. When we receive a hotspot referral, the types of things that we are being asked to look at, should we need to talk about things with you, are your testing protocol, what your status of your baseline testing is, your current infection protocols and any adjustments that you've made for COVID, your plan for employees who test positive, your plan for cohorting positive residents, what your current visitation policy is, and any kind of difficulties maintaining staffing levels and challenges that you're currently experiencing. And most importantly, how we can help you with all of these things. So again, we will notify you directly if we receive any of these types of referrals and work with you at that time. So if you have any questions on any of that or have been involved in any of our QIIs to this point, feel free to chime in and chat. Let us know how things are going and let us know if you have any questions on these items. So just to talk for a minute about our general contract support and what that looks like. You know, the quality reporting assistance that we've been providing for quite some time around Nursing Home Compare and NHSN, as well as some MDS coding that we've recently started. Infection prevention support is definitely really high, of course, on CMS's radar right now of whatever we can do to help support you in your nursing homes as you review protocols, make changes, if you need access to subject matter experts, all of that kind of thing, training materials, resident and family education materials, all of that. Please reach out if there is a need, and watch our listservs for materials that our account managers are putting out on a regular basis. Improvement coaching, QIAP program development, tools, training, and resources. As you start to work on all of those kinds of things in your staff QIAP training, if any of that needs to be refreshed, let us know. Internal indicator monitoring, if you have measures that you're struggling with, things that you want to work on, but you're not quite sure how to approach it, we're happy to provide some coaching and help you there. Data utilization coaching, what do we do with data once we get it? How do we even know we're collecting the right thing? All of those kinds of things we can kind of help you with, in addition to a bank of project management tools and resources that we also have to help you with all of the many projects that you're working on. Survey support, coordinating any ongoing activities with survey agencies. So all of our states have, we have great relationships with our survey agencies and collaborate with them on a regular basis to coordinate things with you, and providing tools and resources for improvement in deficient areas. So if you do have a survey and you have some deficiencies that you'd like us to help you on, please let us know. We're happy to do that and provide those services. Just as a general contract update too, our first round of recruitment was completed earlier this year. The homes in our region are always very engaged, and so we're very fortunate to have achieved our original recruitment targets by February. And having started the contract in November and the holidays and all of that, we were just, you know, really very grateful to have the active engagement and participation in all of our states. However, in April, we received a contract modification that included a nursing home participation eligibility list that was not previously part of the contract. So we are currently still negotiating that modification and that eligibility list. And so once it is awarded, we will have more information to you to provide you on what participation looks like. There continues with the eligibility to be a focus by CMS on support of homes located in rural areas that are serving vulnerable populations and those who have a quality management score less than 4. We are committed to continuing engagement with homes who sign participation agreements early on, and will provide updates to you with any changes as soon as possible. This does not change your ability to participate in any of our educational offerings or activities that I've mentioned so far. So please keep on attending things. Don't change what you're doing. If we need to change something about participation, we'll reach out and let you know as soon as we have that contract award back. How do you get involved? If you are not yet signed up with us and just interested, then we have an electronic version of a participation agreement. And you can also print it out on PDF. So the links are here, and the slides will be sent out to you following the presentation with the recording. So if you're not yet signed up, please reach out to your account manager in your state. And if you have any questions, we'd be happy to answer those about what that looks like. Some of the current activities that we have going on now, there's 3 things on this slide, but I tell you what, there's 100 things going on in the background. Everybody is working their tail off to make sure that we can support you the best way that we can. So this is a very broad and short list of key items that we're currently focusing on. So you can definitely sign up for our listservs. If you're not already in the loop, reach out and we'll get you signed up. And please put our events calendar on your favorites bar so that you can be in the know of what's coming up. We have a lot of things in the fall here that are in the planning stages right now. Several areas we are collaborating with the state epidemiologists to provide in different levels of infection prevention series and training. So that will definitely be a focus going forward. We will continue our state survey agency collaborative calls. And right now underway, it just kicked off last Friday, is a minimum data set coding series that will take place every month between now and the end of the year. Because there have been quite a few changes with the MDS that are affecting the quality star ratings. So we wanted to bring in some expertise and provide you some support in that area. So our link here is to all of our upcoming events. Please click there and add it to your favorites bar. We totally recognize that you have a ton of projects going on and added stress with the COVID pandemic. So whatever we can do to support you, please let us know. And we have some time left here that we just wanted to open it up to all of you and possibly find out if you could chat it in or unmute yourself and let us know what the most important thing is that we could do to support the success of your nursing home at this time. So I'm going to remain quiet for a minute while I let you all ponder and type and to see if there are any questions in the Q&A. And Carrie, thank you. So keep the training coming on COVID-19 and what to do when we get a case scenario, as well as infection control updates. We will absolutely keep doing that. There's a lot of great activities going on, best practice sharing going on out there as well that we can learn from the states that are getting hit a little harder. We're trying to keep in the loop there. Because we have not had, I don't want to jinx any of our states, but we have not had seen quite as many outbreaks. So we're trying to learn as well from what the other QIOs are doing and sharing any of those materials in those larger states with hotspots, for sure. Okay, are there any questions about any of the materials that were covered so far today? Like I said, we will be sending out the handouts that I reviewed as part of this presentation, as well as the slides and a recording, so you will have everything to refer back to. We have another session planned for tomorrow afternoon. I believe it's at 1 o'clock Mountain Time. If you have partners that didn't get to participate in this one, there's still time to register for that session as well. We have several blogs and online tools that are now available, and I did want to point out that we do post COVID-19 updates related to nursing homes, as well as community and personal topics related to COVID through our Healthy Living blog. So if you're interested in getting, you can subscribe to that and get those automatic feeds into your email or browse through what some of the items and things that we've covered. But there are nursing home related topics that are being distributed also through that, and resident and family topics that are distributed through that and our Facebook page. Additionally, we do have several online tools and resources in general for nursing home. Under infection control and quality improvement is where we have put all of our COVID-19 things from every state. So there are a lot of great tools that have been shared with us also from our state partners, the geriatric workforce enhancement programs, long-term care work groups, all sorts of things. So please peruse those tools and you might hopefully find something valuable there. Additionally, we've added a telehealth section to our website that does have nursing home telehealth visit implementation and how to go through that. If any of you are interested in doing that, please also reach out or if you have any questions, there's FAQs there on that telehealth page and whatnot. So, and also a space for you to submit a question if we don't have the answer there. We have a bank of experts that review those questions when they come in, and a bank of partners, telehealth networks and whatnot that can help with those as well. So a lot of tools and resources are available to you. If there are no questions or any other comments, then we will go ahead and wrap up this session for today. Thank you, Glynis. Yes, our one and only nursing home in Guam. All right. Thank you, everybody, for joining me today, and have a great afternoon.